Pharmacy is really the hub in Saskatchewan. There's a beautiful marriage between rural society in Saskatchewan and pharmacists. Pharmacy is the profession of the people. It's grassroots, it's down to earth, it's embedded in the community. Pharmacists used to be a product-based profession. It has become now a cognitive profession. They're therapeutic experts. And that's the pharmacist of the 21st century.
It is a very exciting time to be a pharmacist in Saskatchewan. It's always very different every day because we have so many things that we can help patients with. It could be anything from travel consultations to chronic disease management consultations to catching medication errors or dosing issues.
Are you documenting your blood pressure when you take it?
We're not there just to provide their medication in a bag. We're there to provide pharmaceutical services and help elevate their care, and their health can hopefully be improved because of that.
There's 20,000 plus drugs out there, and the number is growing and they're becoming more complex, and patients' scenarios are becoming more complex. So as a pharmacist, we take years of training just in drug therapy so that we can use that education and our experiences to make sure that the patient is taking medication correctly and safely.
Why don't I buy that? And should my husband also be on it too?
So I think that one of the greatest things that pharmacists do is see those needs and fill them before a patient falls through the cracks, and something that we can intervene in that can be very impactful in their health.
Many patients aren't aware of all of those types of ailments that we can prescribe for. Cold sores, acne, athlete's foot, emergency contraception. We can consult and provide smoking cessation counseling services, and hopefully soon we'll be able to provide any medications associated with that.
So these would be the same medications they would get from their doctor, but we can identify it at the store level, work with the patient, come up with an action plan or a treatment model for them, and avoid that step of going to the doctor.
Recently, pharmacists have been given the rights to do injections, so things like the flu vaccine, shingles vaccine, and those monthly injections like B12. And it's really helped free up the physicians to do what they need to do, and it's a good use of the health system resources.
Pharmacists are now able to look at a patient's lab results. From a pharmacist point of view, we can access, for a diabetic patient, for example, we can access their past history of their blood sugar results or their A1Cs. So that tool itself is a reassurance to the pharmacist that the medication being prescribed is appropriate.
We deal with insurance, the government, numerous times throughout the day to help people be able to afford the medication. The pharmacist can work with the patient to help get that drug cost down, utilizing the Saskatchewan Prescription Drug Plan and other types of programs to make sure the patient is compliant.
I think that developing a relationship with your patients is so important. It's not just throwing a bag of pills at people. When you know the history and you can walk through their issues with them, it really makes an impact for that person in a way that really improves their health.
All pharmacies in Saskatchewan are integrated with the Pharmaceutical Information Program, which we call PIP. That program allows us access to every medication that patients have had, no matter where they've had it filled, in any pharmacy in Saskatchewan.
So I know grandma, I know parents, I know their children, I know the grandchildren. We get to know them, they get to know us, and it makes a much more pleasant and trusting relationship between pharmacist and patient.
A day-to-day practice as a hospital pharmacist involves very little dispensing of medications, which is really, I think, what is a big surprise to most of the public. What hospital pharmacists mostly do is they work within teams, whether that be cardiology, infectious disease, or psychiatry, which is what I do.
If you go up to the north or in different parts of the province, actually the pharmacist is the only healthcare professional within hundreds of miles of any hospital or a physician's clinic or a nurse practitioner. And so your pharmacist almost is a one-stop shop for all aspects of your healthcare. So the beauty of being a pharmacist is they really play an active role in preventative healthcare. And that preventative healthcare has a huge impact on the cost of hospitalizations, and ER visits. And that's why, in order to become a pharmacist in the 21st century, the schooling we have to give them is much more intense. That's what really makes pharmacy really incorporated in the community, and definitely patient first, because they're embedded into the fabric of the community.
It's important for me to have access to a pharmacist kind of as part of my medical team, because they can give me answers to quick questions that would take a long time to get if I had to sign up for a doctor's appointment.
They know you by face, by name. They even know your medication. They know your voice on the phone. You don't have to tell them who you are. And it's just a warm feeling knowing that your pharmacist is there for you.
I've always found them to be absolutely amazing in answering whatever questions I have. And if they don't know the answer, they've gone and they've found it for me. So I think the pharmacist is an essential part of anybody's care team.
I've always thought of every patient as sort of my grandmother or my mother or my sister, people that I actually really care about. And I think it translates really into good patient care. And that's probably my favorite part. They trust me with their health.
I love being part of a team. I love helping patients. I love contributing. And, having patients thank me for being involved just is icing on the cake, really.